Hi, good afternoon. I'm Winston Tan, a medical oncologist at the Mayo Clinic in Jacksonville, Florida. We're at the site at University of North Florida. This is the third Judy Nicholson Kidney Cancer Symposium, and we have Mart and Rachel from Indianapolis. Tell us a little bit about yourself and where you come from and where you're getting treated currently.
Thanks, first of all, Dr. Tan, thanks for having us. Thanks to the Judy Nicholson Cancer Foundation for having us. We're both from Indianapolis, Indiana, and I'm currently receiving my clinical trial treatment at the IU Simon Cancer Center, which is located in Indianapolis, Indiana.
So tell me a little bit about your cancer and what was the most important challenge that you had to face when you were initially diagnosed with the cancer?
Well, I have a stage 4 metastatic renal cell carcinoma. When I was originally diagnosed, I'd say the biggest challenge I had was the fact that within less than a 24-hour period of time, I went from being, okay, I'm extremely healthy, to being told by my urologist that you have to have your kidney removed because it's encapsulated with cancer sooner rather than later. It's a very serious thing. So I think the biggest challenge I had was like having to mentally process a complete 180. I had to go from being, well, I thought was pretty healthy, actually very healthy, to being, wow, I'm very, very, very dangerously ill with this disease that could kill me. And in a short period of time, that's a lot for any human being to process. So just the mental processing of that was a very, very challenging thing to do. And that was probably the hardest thing.
What do you think helped you most to adjust to the process?
Being blessed with a good family and support group, that was the big thing. The first time around, I had my nephews and my family that I lean on and talk to. My eldest nephew's he's a nurse, so I was able to talk to him and have him there as an advocate. And then after I met Rachel and married her in the second round when the cancer came back in a metastatic form on my bones, having her basically to confide in as an advocate and just having a good support group, is huge. If you have by yourself, it's a very, very difficult, next to impossible thing. So having anybody, an advocate or somebody to help you out in any form is huge, very vital.
And great caring doctors as well.
Yes. And I was blessed to have great oncologists as well.
So how do you optimize or utilize your support to your best ability if you had metastatic kidney cancer, and what's your advice to them?
I think the big thing is just being honest with yourself and open. It's my background as far as my nationality is Eastern European. I come from a background where, as a man, you're taught to keep everything in, internalize, don't show weakness, keep it in. But in a situation like that, I think it's important to be open to emotions, to share. If you're having a bad moment, share. If you're having a good moment, if you have questions, it's being open to the process, willing to share, having somebody. I think talking is huge. I think the fact that if you internalize and don't talk and don't share anything, that it's going to make the cancer worse. Create other issues, other health problems on there. So doing your best to be open and have an open dialogue with someone is huge.
I think, too, not looking for your doctor to be the only resource for curing your cancer or to get you through this. You need to do your own research on what can help you. Look at what you're eating, what you're doing. How can you do something to mentally boost yourself through it? If you just lay down in bed and give up, the cancer is going to win quickly on there. It's finding that new drive. In Mart's case, when the cancer came back on his bones, he could no longer work out. He could no longer lift his special needs daughter. This was a huge change in his life. He had to find a new drive, a new interest, and in that we found switching to the vegan food and new recipes and researching that away and looking for other healthy ways to help benefit the medical things that he was having, the radiation and as well as immunotherapy.
I think I'm amazed about your journey, how the turning point in your lifestyle had actually perked you up and changed your attitude towards your cancer. That's amazing. And could you tell us a little bit about the diet and lifestyle that you are doing right now after you were diagnosed with cancer?
No, absolutely, Dr. Tan. First off, I'd like to say it's become strange in my life, but I've gotten to a point now, especially after a lot of, I'm a faith-based man and on there, and I've actually got to a point now where I'm, as strange as it may be to say, in a lot of ways, I'm thankful for the cancer. I mean, people out there will probably be like, wow, that's strange to say, but I've become a better man, better husband, more open. It's in a lot of ways when you look death in the face, you either run or hide, but it's made me stronger, more giving, just give me I'm a better person now, I think, than I was before the cancer. So I know it's odd to say, but yeah, in a lot of ways I'm thankful. And now I'm out in the community. I'm here. I'm actually
Yes, sir.
making an impact where I can help other people, or at least give other people that are cancer survivors like me, say, hey, I hear what he's saying. I'm in a down point, so it's thankful. But more to your question on there, I used to work, like Rachel said, used to work out and do quite a bit. And I came from an animal-based diet, and we've switched entirely to a vegan-based, plant-based diet on there. And it's made quite a bit of difference on there, along with the clinical trial I'm in with Dr. Peely. It's been a good thing, and I think quite a bit. It's made an influence as far as on my health. My lab results are always good. It's improved my health and helped me for the immunotherapy drugs to have a stronger effect, a better effect on there by eating whole foods, a clean, healthy diet on there. It's helped my body. I think that a lot of plant-based diet is that when we came from processed food. 200 years ago, there was no such thing as processed foods. We weren't raised that way. Processed foods are a relatively new thing on there. We evolve. Our bodies are not adjusted to living processed foods, refined sugars on there. We lived off the land, what we could, pick, plant, catch. That's who we are as people. And I think that's the kind of diet we need to live. So that's what we've kind of gone back to, and it was hard to do. Like I said, a lot of vegans will say, the smell of meat makes me sick. No, I'll smell ribs or a burger and be like, man, that smells good, but I know the effect it'll have on my body. My body will tell me right away, it's not good for me, but I just feel better, and there's enough, variations and things you can eat, and it's very cost effective on there that it's an easy, if I can do it from eating so much animal-based protein, anybody can do it. It's been a blessing.
I think going to plant-based, and I did it with him, and the reason we did it was, one, we knew his doctor was doing a study with mice that showed that the mice did better on low protein when they were receiving immunotherapy on there. That was a boost, and we watched movies like What the Health and did research and found that it just seemed like everything worked better with a plant-based protein. Your animals get their protein from plants, and so that whole thing that you need meat to get your protein is not true. A lot of your organizations, your health organizations, are sponsored by the cattlemen and ranchers. They fund them, and so that, of course, they're going to recommend that you eat meat, but you can get your protein from plants on there, and you can find ways to cook those healthy plants. He went from eating meat multiple times a day to eating just plant-based, and he has great energy. He does not have stomach or digestive issues, and he's on 3 immunotherapy drugs, plus he receives Zometa for his bones, to support his bones since the cancer spread to the bones. The only time he is ever down is usually when he does get that Zometa, which is not the cancer drug, and he's down for maybe a day or so. But he doesn't have digestive issues. He is not laying around. He's not tired all the time. He, of course, going to an event like this or something is going to be tired after that.
Sure.
But in general, I think if you look at him, you cannot tell he has cancer spread all over his bones and near his brain, or that he's even a cancer patient.
Yeah, one other thing, I don't know if I mentioned in my talk earlier, but one other thing too is the psychological benefit too, is because when you're a cancer patient, I mean, I guess to a certain extent. I mean, Deb over there being the the minority on there, you don't feel like you have a lot of control. It's your oncologist. You're dictating the protocols. You're dictating, the nurses are doing the infusions. So, everything's being dictated to you, so you don't feel like you have any control. You feel helpless. So being able to control your diet, your nutrition, what you cook, I mean, for me, it was a psychological boost to be able to, have I have some control. It's, I may pick my doctors and do that, but this is something that can directly affect my health and my cancer that I actually control, not you guys, which I'm blessed to have you, but it's nice to be able to have some control.
Sure. How does that feeling of losing control with your new diagnosis of cancer feel, and what were the processes that were involved in trying to cope up with this process of losing control? Knowing that you have metastatic cancer, you have to be on protocol, you have to be following a certain regimen in order to recover. How did that lose control make you feel?
It was difficult. I mean, it was a transition period, especially going from a couple passions in my life, working out, weight training, eating a specific, being able to cook a specific brand of healthy diet, to not being able to do those. Two passions where all of a sudden they were wiped away. I still struggle with it, but it's gotten better. But again, switching to plant-based, being able to cook a different brand of healthy food has helped. Yeah, but the other thing that's benefit is having a support group, whether it be, like in my case, my best advocate,
Yes.
Rachel,
Yes.
you guys, the Judy Nicholson, Kidney Foundation, or any kind of support group you can have. It may be family, friends, a spouse. Without it's a near impossible task. So having somebody to lean on, because you're going to have moments where you can't stand up. You need somebody to lean on. It's reality. I don't care how strong you are. You're going to fall. But the important thing is that, you get up or have somebody to help you up, as the case may be. So support group and having people out there. And then we're also very faith-based. So, we have a lot of people who have been saying prayers, and we put a lot of faith in God and also believe in that as well. So that's a huge benefit and, contributor as well.
Yes. And you have heard very clearly from Mart and Rachel that just feeling vulnerable, being willing to be in a safe environment where they have friends, relatives, and above all, their God to help them go through the process. Emotionally, psychologically, they were able to cope with the situation. You have heard also clearly from them that defining a moment, that defining moment of going into a vegan diet changed his life dramatically from a bedridden metastatic patient now to a happy, not side effect free, but well-looking person enjoying life to the fullest. And that's the reason for why we treat or why we try to extend life, is that even though you have metastatic disease, we want you and other patients to live a full life. That's why it's known as living with cancer. Thank you for your thoughts. I have one more question before we go about clinical trials, and what's your advice to patients who are trying to sort out what are their treatment options? Tell us a little bit about second opinions. Tell us a little bit of how you look at the internet for information. There are many things that you're confused. You're having a new diagnosis. You don't know where to go. What are the guidelines that you would give to a patient?
Well, I would strongly encourage you, if you don't have the resources or ability or means, to find an advocate, whether it be through, like in my case, my wife. I was blessed with a good oncologist that recommended a clinical therapy. So I was blessed, but again, it wasn't quite available, and we really didn't have another option. So, my strongest advocate, got on the internet and found another clinical trial that was going to work for us. So it gave another option. We took it to my oncologist. He was like, "Oh, I didn't know about this." Made a quick call. He happened to know the doctor from a conference, and found out, yeah, I was eligible. So next thing you know, we're going to an alternate plan. So it's having an alternate plan, being your best advocate. Now, I mean, not everybody's as blessed as I am. They may not have an advocate or somebody that's internet savvy or have the means or understanding to go through data. So if you don't, there's resources such as the Judy Nicholson Foundation, or any major hospital should have, other resources. Or if your doctor doesn't know, then get a second opinion. Go to another oncologist, another if your general practitioner he's not going to be the expert. Go to an oncologist that has one. If he doesn't have the best opinion, go to another one. It's kind of like going to therapy on there. If you don't click with your therapist, you're not going to necessarily click with your therapist, so you may have to find another therapist. Same with your doctor. If you don't click with your oncologist, or he doesn't have opinion or can't answer your questions, then find somebody else. There's lots of options out there. And if you don't feel comfortable, you're not the kind of person that's detective-like, that wants to do their own research, find somebody else. There's tons of resources out there. It's more than I knew before I had that. I had no idea. Now that I'm in it, it's even with her, we're like, wow, we have all these, resources, Judy Nicholson Foundation, that are more than willing to help you and help you find alternatives.
Our government has a website, I don't know it off the top of my head, for clinical trials. It is purely our government running, so you can trust it. And you just go on the website, you put in what type of cancer you have, and you may have to list what stage, and then you put kind of the radius that you're willing to travel for the clinical trial. You click search, it's going to pull up any clinical trials in that area for your type of cancer. Your next step then is to look and see, based on your type of cancer, as it metastasizes, it spread to the body, do you have to have already tried a certain drug first before you can be on the trial or not? Does it have a placebo or not? I think the general thoughts in America is that if you go on a clinical trial, you may get a placebo. That's not the case. There's several trials out there that do not use the placebo and can give you a true option on there. As many people know, the regular chemo drugs can be harsh, and there are other alternatives to try as well.
Thank you for clarifying that. The website is clinicaltrials.gov or cancer.gov. If you do not have any help, Judy Nicholson, in collaboration with the International Kidney Coalition, can help you. IKCC.org and judynicholson.org, or Indiana University or Mayo Clinic, big institutions can help you, guide you in that journey. And very important processes that are involved or need to be known with cancer patients is don't be afraid to ask for help, because there are people who are willing to help, like Mart and Rachel here. That's why they agreed to be interviewed, because they want to help you. They want to give you hope. They want to give you the same vision that Judy Nicholson has for you. Thank you very much and have a good day.